And we are back on Capitol tonight. If you are a, let's try that again, because I can't speak English. It's Friday, man. And we are back on Capitol tonight. If you are a watcher of national news, a frequenter of Facebook and Twitter, or a fan of C-SPAN, my next guest will look very familiar to you. This week he's been barnstorming across the internet and the airwaves to celebrate the one-year anniversary of President Obama's signing of the health care reform bill into law. And unlike other Democrats who wince when Republicans call the measure Obamacare, he's actually proudly embraced that moniker. Although that is not to say that he's in lockstep with the Obama administration. Quite the contrary, actually. He does not hesitate to criticize the president even on the health care overhaul, which he actually wishes went much further. Joining us now from New York City is Congressman Anthony Weiner. Congressman, thank you very much for joining me.
My pleasure. Thank you, Liz.
I think I actually might be the only outlet that you haven't spoken to yet, so I'm very glad that you are here. And I actually want to ask you about, when you've been all over the place this week in celebration of the healthcare reform law, and you said healthcare is a little bit like Buddhism. We know it's going to change, but we don't know how it's going to change. Can you explain that?
Sure. I mean, it refers to the idea that, you know, people say, well, why did you have to do anything? Why did we have to pass any law at all? Why couldn't we just leave it alone? The fact is that today, healthcare makes up about 20% of everything we spend on every product. And on the arc that it's going, it was going to be 50% in the next 20 years. And we knew that we couldn't let that happen. And so the only question was how it was that we addressed the problem. Now, my Republican friends remind me of the expression, it takes a great man to build a barn, but any jackass can kick one down. The Republicans have basically taken everything we've proposed and said, well, we're against that, we're against that, we're against that. And this is a week that we celebrate the one-year anniversary of the bill being signed into law, and it's done a lot of very good things.
Okay, but even you are not 100% thrilled with this. I mean, you pushed Medicare for All, if I remember correctly, and you didn't get anywhere near there.
Well, look, there basically are two ways we get health care in this country. One is a program like Medicare, Medicaid, the Bureau of Indian Affairs, the Veterans Administration, where the government collects the money and passes it along to doctors with very low overhead and with no profits, obviously. It's the government. On the other side of the coin is the employer-based model that you and I get our health care through. And that's where the insurance companies come in, and they take a lot in overhead, and they need to make profits. And there was a debate in this country that during that health care debate about which one we were going to kind of double down on. I wanted us to go for kind of an expansion of Medicare to more Americans. But in fact, we decided to go the more free market, the way the most Republicans theoretically would like, which is giving people subsidies to buy private insurance. But I'm not the only one who thinks it didn't go far enough. If you look at a lot of the polls, when people say, do you like health care, they say, oh, no, I don't like it because rates are still climbing up, or I don't like it because it doesn't cover A, B, or C. Those are people who are also saying that they didn't think health care went far enough.
But actually, you see a lot of people also, I mean, you saw a whole bunch of people who were elected in 2010, elected on the idea of repealing it. And the Republicans were very popular on that particular topic. So then to say now that it's a big success in the wake of the shellacking, according to the president, that the Democrats took in 2010 seems to be a little incongruent, no?
Well, there's two different questions. One is whether the bill is a good bill, and the other is whether politically it's been handled well. I believe one of the reasons I think that this Republican effort to go back and revisit it actually gives we Democrats an opportunity is we need another bite at this apple. We didn't do a very good job last time. You know, you can have a long conversation about whether or not people did better in 2010 by saying, I proudly voted for that bill and here's why, to whether those people did better than the ones that hid under their desk and hoped that the thing went away. And there's another conversation that we need to have in Democratic circles, and that is a lot of my Democratic friends who think by voting Republican is the way to protect themselves learn that didn't work. When people have a choice between a real Democrat and a Democrat who's voting, a real Republican rather, and a Democrat who's just voting like one, they choose the real Republican.
See,
but that's a That's an argument that has been going on in the Democratic Party for some time.
Right, and it's actually one that we're having in Albany with some degree of frequency. I mean, the people on the left are very unhappy with Andrew Cuomo. They say he's frequently compared to Chris Christie, who's of course a Republican who's in New Jersey, and they're very unhappy with his fiscally conservative budget that includes Medicaid cuts. And I'm wondering what your opinion is of the job that he's been doing.
Well, look, I've got enough problem with the Washington budget than with the Albany budget, but I will say this. I think there's something to be said for the idea that there is this notion that we need to have more bipartisanship today. That needs to give way to the idea that bipartisanship is a means, it's not an end. And I think that Democrats do themselves a disservice when we don't fight for the things that we believe in. I think that most Americans and most New Yorkers, they want to know that there are people who are saying the things they believe in and fighting for them. And that's why this week, rather than cower and hope the conversation about health care turns somewhere else, I've been out there forcefully advocating for it. I think that we're going to do well as Democrats if people know what we stand for and know what we're willing to fight for.
Well, isn't the problem, though, that the left stands for one thing, which includes, say, taxing the rich, and the more moderate Democrats in the center don't necessarily truck with that, like Andrew Cuomo, for example, or you know, there's a fight now between the downstate Democrats who want to do rent control laws. I mean, isn't that the issue, that you have the liberal wing of the party, just like the Republicans have the Tea Party wing that pushes them, skews them, maybe you might argue, to the right?
You're exactly right. The diversity of our caucus as Democrats is sometimes messy. You know, frankly, Republicans have a pretty easy job keeping their caucus in line. They say we're against tax, you know, we're for tax cuts, smaller government, we're against social programs, and we're for the death penalty, and we're off to the races. You know, for Democrats, we're a much more diverse caucus, but it's also, it's almost indisputable. You know, we're a smaller caucus in Washington right now because we didn't stick to our abiding principles and fight for them as much as we could. We've done a great job legislating, just haven't done a very good job articulating our values. And you know, I think that that's going to be a problem we're going to continue to have, but I think ultimately more people agree with Democratic ideals, with a capital D, than agree with Republican ideals.
Your caucus is actually going to get even smaller. I mean, in New York, at any rate, from the congressional delegation that's going to New York to going to Washington from New York in 2012 is going to be -2 people. What do you believe should happen? Should we lose a downstate and an upstate seat? Do you believe that there should be nonpartisan redistricting, which is something that Andrew Cuomo and Ed Koch have been pushing for?
I believe we should eliminate 2 Republican seats.
Yes, of course you do, naturally.
But look, here's what I think. I think that first and foremost, we have to make sure the census is correct. The numbers we got this week were mind-boggling in many ways, based on what this previous census estimates in the intermediate years had told us they were going to be, based on common sense. I mean, many of us who walk through the streets of Queens, they seem just jam-packed, even more crowded than ever before, and also based on some real hard analysis. If you look at buildings they say are empty, the Department of Taxation says we know who's in there and we know who's paying taxes in those buildings.
Okay.
So I think we've got to get that right. But I got to tell you something. I am concerned about the idea of having a nonpartisan election, a nonpartisan redistricting, when we have states like Texas that are doing the most partisan things imaginable to eliminate Democratic seats. When you have, you know, I believe that we should, that the fair process here can be the political process too. I don't think there's anything inherently wrong with saying, you know, let politics have its way, especially since you have a Republican Senate and a Democratic Assembly. I'm not sure necessarily a nonpartisan redistricting is going to get us any better outcome.
Have you expressed that opinion to the legislative leaders and the governor?
Whenever I do that through you, Liz. That's when I want to get them a message. I come on this show and I speak forcefully.
All right, Congressman. Well, I want to thank you. We're out of time, but Anthony Weiner, thanks very much for being with us.
Thank you, Liz.
Very much for sticking around. I appreciate it.